It is November, and there is a week in this particular month that is from 18 to 24, which is being specified for the awareness that is preventing antimicrobial resistance. We have certain medication known as antibiotics, those which are used to kill certain germs. So when we use these antibiotics in a wrong way, what will happen? Then we won't be able to kill the germs for which they were supposed to be used. So what is happening if we are using it in a wrong fashion? Simple. We are supposed to give one medicine, that is A, for about 3 days. This is actually the specified time for this particular medicine. And there is a particular strength of this medicine. Particular strength, particular frequency, particular duration, days. So if we don't follow the specific strength, frequency and duration for the particular medicine, what will happen then? Then this particular agent, the germ that is actually present for which this medicine is prescribed, that germ, that germ will actually modify itself, in a sense that if next time we are giving the same medication to the same patient, then that medicine is not going to be functional anymore. These germs are actually modifying themselves in a way that the medicine is not going to act on them. Got it? So we must use medication in a proper regime. I mean, we must use medication as it is prescribed by the healthcare provider to us. Okay? A medication should be taken of particular strength, 5 mg for 5 days, and BD 2 times a day, or 3 times a day, or 4 times a day. So I mean that we must follow the prescription. One must not follow the medication by oneself. Okay? One must follow his or her healthcare provider. That is the point. So what is happening right now, if our doctors and public, if they don't follow the healthcare protocol, what will happen then? Then the germs, then the bacteria for which the antibiotics are actually used, then they will modify, and it is expected that by the end of 2050, all available antibiotics won't be able to do their jobs. Means they will not be functional to fight against the germs. So what will happen then? A very small type of disease will lead a person to death. So that will be very much complicated then. Okay, the point of very concern that we must be careful while dealing with the antibiotics. So what to do now? Very simple. We have to diagnose properly, we have to dispense the medication properly, and we must be very keen with the screening of the prescriptions from all the dimensions. It starts from the physician's hand, and it must end by the end of another doctor, which is called as doctor of pharmacy. So what is happening hereby, if this process is actually followed, then the proper medicine will reach the proper patient. Right medicine will reach to the right patient and right time in right amount, and by the end of the day there will be the proper use of the medicine. So if we follow the proper strategy, the proper protocol, the proper path, the proper regime of the drug, of medicine, of antibiotic, of anything, then ultimately it will lead us to the cure or treatment of the particular disease. So that's all from my side. I hope you guys still have confusion anywhere. You can ask us in the comment box, and I hope I just put a small part in the awareness week, and I hope it's helpful. And if it is, then just share it with your friends and fellows. Thank you for watching.